everybody. It's Tom Jones Pharmacist live. Hey, this is the second time tonight with 2 streams, and we had a little problem with our first one, so we're doing it again. Thyroid. The impact of hyper and hypothyroidism on your health. We're going to talk about it tonight and give you the answers. Yes, we are here. Have you gained weight lately? Are you constantly in a state of fatigue? Or maybe you're losing weight for no reason. These symptoms indicate a thyroid disorder. And are you really having problems with your metabolism? And if you are, it's definitely affecting the way that you feel. So even with the slightest dysfunction, it can cause havoc to your health. It can cause mood swings. It can cause weight gain. It can cause habits of bad things happening to your body, and you can have low energy, constipation, all sorts of weird, bad reactions. So hypo and hyperthyroidism are basically common thyroid disorders, and everybody is affected by it. Each condition has specific, special symptoms, and it requires immediate treatment. Women are up to 10 times more likely to have thyroidal problems, and they just don't really understand all the different consequences that happen with the thyroid. And you really don't think of the thyroid, and doctors don't even think of it routinely when you go in for rechecks. So thyroid plays a major role in metabolism, and it affects the way you feel, and that's just the bottom line. All right, let's next look at thyroid and the symptoms. So you want to actually look at all the different things that go on with the thyroid. And really, it's a condition at a glance that you wouldn't think about causing all of the issues. But yes, 27 million people suffer from thyroid. Of that, 13 million don't even know they have it. Let's repeat that again. Almost 1/2 of all thyroid sufferers don't realize they have thyroid issues. And it's 1 in 8 women. 1 in 8 women who will develop a thyroid disease during her lifetime. And thyroidism is a major culprit in the marketplace. Hypothyroidism is actually caused by an underactive thyroid, and that occurs in 5 out of every 1,000 pregnancies. While hyperthyroidism, that's an overactive thyroid, and hypo is an underactive, but the overactive affects 1 in 500 expectant moms. Thyroid disorders for older people over the age of 60 is so common that people kind of assume you got a thyroid issue if you're 60 years of age or older. So it is so common out there, and really, according to health experts, the rise in thyroidal issues actually coincide to environmental toxins and exposure to pesticides, BPA, to perchlorate, to cigarette smoke increases the risk of developing thyroid disorders. Other causes of thyroid are radiation exposure, autoimmune disorders, certain bacteria cause thyroidal issues. Regular consumption of soy products. The soy products is in our diet, in our food supply. Supplemental iodine. Oh my God. Celiac disease and gluten allergies. Those are just some of the causes of thyroidal disorders. All right, let's now talk. We're going to talk about specific types of thyroidal disorders. Hypothyroidism. All right, that occurs obviously when there's not enough thyroid. And when you don't have it, that means 5 out of 100 people in the United States has this condition. Its symptoms are multi. Constipation, muscle and joint pain. You've got increased sensitivity to cold. You've got weight gain. You've got fatigue. You've got goiter. You've got a slower heart rate. You've got depression. You've got dry skin and heavy menstrual cycles. And the list goes on and on. We just named a few. Since this disorder actually develops slowly, it goes unnoticed. It goes unnoticed to the general population until you walk into the doctor's office and you tell them that you think you've got thyroid disorder, or they catch it with a test. And it can go on for months, years, tens of years. So thyroidal conditions really are rampant in the United States and all around the world. So, all right, hypothyroidism actually occurs when your thyroid gland basically doesn't produce enough of the hormone. So several factors can cause an underactive thyroid. So, in general, iodine deficiency is the primary factor for being responsible for the onset of hypothyroidism. This condition is triggered also by certain medications. An injury to the hypothalamus, Hashimoto's thyroiditis, and it can be surgical removal of the thyroid. It can be also inflammation of the thyroid gland. Some people are unlucky enough to be born with a poorly functioning thyroid. The disorder is actually treated with a couple of different ingredients, generally. Number one, levothyroxine is the most widely prescribed drug in America today. Levothyroxine is T4. It's the inactive form of thyroid. Thyroid can be treated with Armour thyroid. Now, Armour thyroid is a thyroid that has two different types of thyroid in it. T3, that's the active form of thyroid, and T4. So that individual, when they take that drug, get both forms of thyroid. Also, it can be treated in occasional cases with T3 only. So those are the different types of thyroidal products on the market in the U.S. today and around the world generally. So most patients actually who take hypothyroidism products generally take it for their lifetime. However, some people are fortunate enough to be able to stop it at some time during their life. That is, unless they choose to actually go in and seek alternative methods of healing. So now, let's talk about hyperthyroidism. And hyperthyroidism is the overproduction of thyroid hormones, and that's actually, it can develop before or after pregnancy. It affects up to 5 women, and there are 5% of women, and there are several forms, such as Graves' disease. There's also pituitary gland malfunctions. There are toxic adenomas and subacute thyroiditis. When the thyroid gland becomes overactive, your metabolism increases. And this can cause a variety of symptomatology, symptoms including rapid weight loss, bulging eyes, diarrhea, trembling hands, and irregular heartbeat. Most people suffering from hyperthyroidism actually experience muscle weakness, they experience insomnia, they experience lots of other things, hair loss, they may lose weight pretty regularly, and actually eat a regular diet and still lose weight. There's increased perspiration. They also really, the symptoms actually can be managed temporarily, usually with beta blockers that actually slow the process down, and other different types of drugs. If it persists, the doctor may recommend radioactive iodine treatment or medications that suppress the thyroid function. In severe cases, surgery can be the only option. Both hypothyroidism and hyperthyroidism require treatment. Without proper treatment, it may be the cause of severe complications such as thyrotoxicosis and also coma, heart problems, infertility. However, there are alternative options available, and it is important that you educate yourself so that you understand all the aspects about the thyroid and the conditions, and you educate yourself if you want to go down the more holistic type approach or functional medicine type approach, then you will be able to make an educated decision on how you address this huge problem of thyroid disease. We're going to continue our series. We'll continue it tomorrow. This is a long type series that relates to treatment, options, functions, all the different things that you're going to need to know about your thyroid and related issues. Again, my name is Tom Jones, Pharmacist. We're here to educate you and give you the most current information and the best information out there. We pride ourselves in hearing and listening to what you are asking us to do, and this is one of the key things that you've actually told us that you want the most education about. Again, my name is Tom Jones, Pharmacist. Thank you so much for being here today. God bless, and we'll see you soon. Thank you. Goodbye.